I get to brag about the Laney Graduate School for a little minute. So good afternoon and welcome. My name is Lisa Tedesco and I serve as Vice Provost for Academic Affairs Graduate Studies and Dean of the James T. Laney School of Graduate Studies. We're so delighted to have you here today. This is an important and timely moment, a conversation moment for us on graduate education and global development and our connection and our responsibility for the global good. I'd like to thank our convener for this event, the Institute for Developing Nations, IDN, under the leadership of Dr. Sita Ronshaw-Nielsen. Thank you, Sita. The Institute helps us connect research and academic programs at Emory with the Carter Center, especially with the Carter Center's Peace and Health programs, to strengthen scholarship on development and directly link our scholarship and research to development efforts in some of the poorest countries of the world. The Research University has a unique responsibility, a time-honored responsibility to link our work, to apply our work, to solve global problems and benefit the greater global and public good. It is good to see all of you here today to hear more about how we are collectively taking up this responsibility, especially in this troubled week post France, Paris, and other parts of the world. At Emory, our long partnership with the Carter Center has allowed us to build a bridge, a strong bridge, to work on global action. And it's been my pleasure and privilege to see that bridge continuously renewed as it keeps up with the more importantly complex problems of this changing world. As we've seen on this campus, perhaps most vividly during the Ebola pandemic last year, the complexity of addressing problems requires focus across disciplines, not in silos, across disciplines that are represented by public health, government and policy, culture, economics, religion, history, political science, the social sciences, and more. Our strength is in our partnership, the university and the Carter Center, and we choose to work together for the global good. So now let me introduce our panel of world changers and world makers. We have with us today Oumer Abdurahman, Foege Fellow and formerly from the Ethiopian Ministry of Health, Grant Buckles, Laney Doctoral Student in Political Science, Amelia Conrad, Laney Graduate Student in our Masters in Development Practice Program, Nicole Devereaux, Master's Student in the Rollins School of Public Health, Abidemi Fasanmi from the Laney Graduate School, who's in Women, Gender and Sexuality Studies, Daniel Thompson, Laney Doctoral Student in Anthropology, and last but certainly not least, our special guest, and I can say on this occasion, my university professorial colleague, President and University Distinguished Professor Jimmy Carter. Thank you all for coming today, and please welcome again our colleagues here.
Well, thank you, Dean, for those nice remarks. As a matter of fact, the Carter Center was founded almost 35 years ago on this campus. We had the top floor, one room at the library, and Steve Hockman was our only employee for the Carter Center then. Since then, we've expanded slightly. We've had programs in about 80 countries on earth, and we've dealt very deeply with neglected tropical diseases, primarily among the health projects we've had. This year, we expect to treat about 71 million people on Earth in the different countries, which is about 7 times as many as live in the state of Georgia. So that shows you how many people we're keeping from going blind and keeping from having worms come out of their bodies and things of that kind. We just finished our 101st election. All of them have been troubled elections or potentially troubled elections. This was in Myanmar, formerly Burma. And we were warned not to go to Burma because of the massive expectation of cheating and violations of democratic principles by the military leaders. But they surprised everyone by permitting a reasonably honest and fair election process. So that's another thing that the Carter Center has done. And we have other programs too that where we try to promote peace, dealing with sometimes nefarious people or people who are outcast in the world community. with whom our own government, the United States government, won't relate because they are sometimes branded as outlaws or criminals or more recently, earlier communists, and now they're branded as terrorists. So the Carter Center still tries to deal with these people if they are the root or the basic cause of an unnecessary war or terrible human rights violations. We go and meet with them directly to try to get them to correct their problems. But I've been reading very thoroughly the preliminary presentations of these panelists today, and they bring out the best, I think, in what the Carter Center has tried to do over the last 35 years. These are young people. We have a very active intern program. I think we still have a couple of vacancies available for this next year. Is that when?
That's correct. We currently have the applications open. And we also have a graduate assistantship that's open.
Graduate assistantship open. The Carter Center began earlier. Most of our, at least half of our interns were from Emory, and now Emory still has the most of the number, but we've had them in, tell me how many universities, 600?
Yeah, I believe it's
about 600 different universities on earth have sent interns to the Carter Center. And we cherish these, and they do tremendous practical work on their own in conjunction with the Carter Center, as will be vividly demonstrated today by these presentations. And now, I don't know if I need to do it in order or not. Oumer, why don't you start then?
Okay.
You, yeah.
My name is Oumer Shafi. I'm from Ethiopia. I am Foege Fellow. I think I will talk about myself later after the introductions.
No, you go ahead and make your presentation if you like.
Okay.
But it's your program, if you don't want to.
I think it's very fair for me to start with thanking you, President Carter, for helping Ethiopia, especially on neglected tropical diseases. You have really done a great job when Ethiopia neglected people. We are really lots of achievements so far, really. In Amhara region, I hope Nicole will talk about it. The reduction in trachoma, blinding trachoma, is really amazing. And the number of cases we have in guinea worm now, globally less than 30%, are now 4.
I think 4 cases now.
Congratulations. So, so we are almost there. So your job in Ethiopia was really, really amazing. And also you were working on onchocerciasis program in many zones of Ethiopia. But despite the region-specific or regional state-specific works in Ethiopia, Ethiopia has forgotten neglected tropical diseases for many reasons, for many years at national level. The reason they were giving at that time was somehow logical, because tuberculosis was killing people, malaria was killing people, HIV was killing people a lot. And they thought, let's prioritize the non-killers and focus on killer ones. It took fairly long time for Ethiopia to come out from very long civil war and become a stable country, and then build its own health infrastructure. And then at some point, the government understood that we have to give attention to NTDs now. The reason given at that time was that this is in 2013. The development in health infrastructure, which was like, for example, before 8 years, we had 600 health centers, and now we have more than 3,500 health centers. The huge expansion in primary healthcare unit, the formation of health extension workers in the community, and the training of the accelerated cadres of health officers, which your organization really supported as well, has favored Ethiopia to change its policy in neglected tropical diseases. So I'm going to tell you kind of a story because I'm an African. We tell a story, we don't write it.
And I'm a Georgian. Right?
Yeah.
we like to tell stories too.
So one day I got a call from the then state minister. Now he's a minister, and he said we're going to change our policy on neglected tropical diseases, and he said we want you to establish it at national level. It was a very difficult surprise and difficult job for me because I don't know where to start. So I started looking at people, getting the right people to work with. And at that point, the CART center's support was amazing because there was already precipitated knowledge, already a huge amount of knowledge, especially in Amhara region. So for me, it was very easy to establish a program at national level. It's just stealing the knowledge from experts from the CART Center and work at national level. So I have to say, people were very kind. Dr. Tashoma Gabriel, who was your former country representative in Ethiopia, Zarihun Tadesse, who is now country representative in Ethiopia, and even at headquarter level, Paul Emerson, who was a director for now International Trachoma Initiative, but Trachoma Program at that time. Yes. Frank Richards and Moses Katabarwa. They all were really waiting for Ethiopia to take action, and they were really helpful in supporting that activity. So the minister asked me to launch the program at national level. So we started by looking at important people, and then we prepared a strategic plan nationally. Within a few months, we launched it. That launch was not really national launch because it turned out like people from all over the world that came to Ethiopia and attended that meeting. So it wasn't a really kind of national meeting. So after the launch of that strategic document, that document was kind of empty it doesn't have full data in it. So we need mapping of entities. So we started by trachoma mapping, supported by DFID in other regions of Ethiopia other than Amhara, because Amhara has had long history of trachoma program implementation by the CART Center. We mapped the whole nation in a year. We mapped the whole nation for schistosomiasis in a year. In the same year, we mapped the whole nation for soil-transmitted helminthiasis in the same year. We did what EPOC says, delineation of transmission zone for onchocerciasis. So we mapped the extent of transmission from the western part of Ethiopia to eastern part of Ethiopia. And also we mapped the disease we call podoconiosis, which is elephantiasis from clay soil. After that mapping, again, it gives us really amazing results, especially on trachoma. Even though there was huge impact in Amhara region.
Take about 1 more minute, okay?
Yeah.
Is that okay? Take about 1 more minute.
Okay.
Go to 6 people in 1 hour. So,
yeah. So that data gave us like the prevalence of trachoma in Ethiopia is really amazing. More than 70 million people are at risk of trachoma now, today. So we need to scale up for Ethiopian farmers, for Ethiopian mother. If you tell them that you have mapped the disease, they don't understand it. They need the treatment. They need the support. So we started looking for resources. The country is so big, as you know. We started scaling up treatments, and we have a reason to hope. We have our partners. I'm happy that Dr. Mark Rosenberg is here, the task force. It was amazing that they formed a coalition of drug donation system, at the Task Force for Global Health. So we had a reason to hope. And then we really start up scaling these treatments. And really we scaled up like trachoma treatment from 18 plus something to 44 million now. To put this in perspective, when Zitromax comes to Addis Ababa, when it arrives at Bole International Airport, they are not happy always, because we are receiving more than 2/3 of the global donation of Zitromax. So it takes a lot of space for the airport. They don't like it. I just want to show how big the program is. For onchocerciasis, it becomes like 9.9 million treatment. And we are a bit slow on schistosomiasis and STH, but it's really still growing. So in that whole process.
Why don't we'll come back to you later, okay?
Okay.
Because we need to go to I'm sorry. Grant? You want to go next? We'll come back to Oumer.
Hi, I'm Graham Buckles. I'm a PhD candidate in political science, and currently I'm the ELMO Initiative Graduate Fellow sponsored by the Carter Center, IDN, and the Laney Graduate School. And I study democratization. Specifically, I'm interested in answering the question of why are some cases of democratization successful, while in other cases we seem to see elements.
You want to tell the group what ELMO is?
Yes, well, ELMO is an open source reporting and monitoring tool. It's been used by the Carter Center in elections. It's currently being used by civil society organizations to monitor a variety of outcomes, not just elections, but health outcomes, human rights violations, and things of that nature. So that's the general focus of my fellowship. And my own research has focused on when do we see successful cases of democratization. And in answering that question, I focus specifically on opposition political parties and their strategies. I think this is an often overlooked part of democratization. Many people, especially academics and many practitioners, have focused solely on regime actors. But I think opposition parties play an important role in determining whether boycotts occur, whether election results are accepted, whether protests occur. And then the focus of my research is whether opposition parties are actually co-opted or whether they present a genuine challenge to the ruling party or incumbent. And so co-optation is essentially the process of buying off opponents through the use of access to rents or political appointments. And this is obviously not necessarily good for democracy because it's a way of neutralizing rivals for incumbents. And this helps to reinforce the status quo and kind of prevents pressures for democratization. And so I explain in my dissertation that co-optation is normally a project of poor accountability of opposition leaders to activists. And in many cases, they will resist being co-opted if they have strong accountability. And I provide a variety of circumstances under which this accountability occurs in my dissertation, but I think the most important point to understand is that we really need to focus on opposition parties when we study democratization, opposition leaders as well as their activists. And from doing that in my work, I've focused on the problem of informational barriers of coordination between activists. They have a hard time keeping their political elites accountable because they're unable to communicate due to repression or fluid political circumstances or what have you. And this relates back to my work with the ELMO initiative. ELMO helps, since it's an open source tool, grassroots organizations on the ground can use this tool to collect information, to aggregate information, to share information, which helps them to actually keep their leaders of all political stripes accountable. And so I think my general recommendation for my research and my work with ELMO is to really emphasize in both academic work and from the practitioner's perspective to really focus on increasing the capacity of opposition parties as well as helping grassroots organizations participate in the democratization process.
Very good. Elmo is a little machine. It looks like a Kindle, and it's able, when you go into a voting place to monitor the conduct of the election, you can enter your data there and then immediately transmit it to a central location. So it gives the election monitors a very early way to give a picture of the entire country, even though you have maybe 80 different groups scattered all over the country representing the Carter Center. So Elmo was designed for us by the Carter Center, and we are the ones that use it. And since you can go to a particular place and get data about an election, you can also do the same thing on a health program. You could go into Ethiopia, for instance, into an area that has trachoma, and you can transmit immediately to the Central Health Ministry data about what you find at that particular location about trachoma. Then you don't have to send a message when you don't have normal communications, but you can get the message in directly by radio. It's a very good program, and to combine Elmo with democracy is what we're trying to do. We've used it now on about 10 elections, and then we've got increasingly better results because we've improved the particular machine. Thank you very much for that presentation, Grant. And now we'll turn to Amelia.
So I work with the Carter Center's Global Access to Information program this year as a graduate assistant.
We have the big boss back here, as you know.
Hi, Laura. So under your leadership, the Carter Center pioneered the field of access to information beginning back in 1999. And what was particularly innovative about the Carter Center's approach, as I'm sure you know, is the Carter Center started these long-term in-country field offices that stayed in place not only for the passage of access to information laws, but also into the implementation and enforcement phases of that access to information process. And since 1999, the Carter Center has had 6 of those long-term in-country field offices in Jamaica, Bolivia, Nicaragua, Mali, Liberia, and China. And in some of these countries, the access to information laws were passed and implemented, while in other countries, voluntary openness strategies were piloted in select government agencies. So what I'm going to be working on this year is conducting an evaluation of those programs to determine how successfully the Carter Center's programming was carried out and to what extent that programming contributed to the advancement of the right of access to information.
You've already begun that assessment, have you not?
We have begun, yes.
We're waiting with bated breath to see what your assessment's going to be.
So we're still very much in the preliminary stages of this project, but I wanted to discuss a few of our early initial findings.
Please.
So looking at those first 3 core country programs, which were Jamaica, Bolivia, and Nicaragua, and comparing that with some recent academic literature, what I'm seeing is that this pioneering work of the Carter Center largely mirrors the emerging best practices in the field of development policy and programming. And just a few of the highlights of that are that context is obviously a key determinant of success or failure, and the Carter Center was knowledgeable about that, and in places where it recognized that access to information as a tool to fight corruption might not be politically viable, it used a rights-based approach, and the approach was adaptive and responsive to each of these contexts. Local ownership and political will are indispensable, and the Carter Center recognized that again and engaged in countries where national governments requested their assistance and where other key stakeholders were supportive of their involvement. You yourself visited several of these countries and met with key stakeholders, which was critical in building political will and momentum. And then the Carter Center was conscious enough to staff its field offices primarily with local hires and to seek to engage local civil society partners as well. In that vein, the Carter Center worked to engage multiple stakeholders, which were not only government and civil society, but also the private sector, media, and religious organizations. And so as a part of this evaluation, I'll be looking at the inclusivity of that approach in these core countries. And finally, capacity building was a critical part of this project and was an important key to building sustainability of these programs. So some of the ways that the Carter Center did that were through workshops, courses, trainings, international consultants who provided feedback on improvements in archiving and record-keeping systems, and the production of guidebooks and manuals to further the implementation of those access to information projects.
Very good. I think everybody here realizes that for a government to be honest and fair and to let democracy work, the people who live in a country have to know what the government is doing. And quite often in a dictatorship or even below dictatorship in oppression, the people are deprived of a right to know what the government's doing. They have secret contracts with very favored rich people, for instance, and some certain portions of the population are just naturally excluded from having access to information about what the government is. And this particularly applies to women. And we have found out in the last year or so that women are particularly deprived of access to information about their own government. So a woman doesn't know, for instance, that she might be legally okay to inherit the property of her husband if he dies. Or a woman may not even know that she has access to own children. If the husband passes away, then it doesn't go to somebody else in the family. Or a woman doesn't know that she has a possibility to get a loan from the government for agriculture. Her husband will know it, but a woman will not. So we try to address those root causes of deprivation of access to information, which is a basic cause of deprivation of basic elements of democracy and freedom. And that kind of assessment is going to be very helpful to all of us, because I'm sure it's going to be very objective and fair, right, and very stern. You've already found that there's some serious problems with Bolivia, I understand. Is that correct?
That's correct,
And
yeah.
and I think we have also, is that correct? So Bolivia was, but I think we have another chance. The president of Bolivia happens to be a very close personal friend of mine. He's been to my peanut farm twice, and I have promised to visit his cocoa plantation when I go down to Bolivia again. So we have a possibility of opening up Bolivia again. But your finding that we have not been successful in a certain country is very beneficial to us and obviously to the people who live there. Okay, and now we go to Nicole. Nicole.
Hi, I'm Nicole Devereaux. I'm a student at the Rollins School of Public Health at Emory. I've been with the Trachoma Control Program for about 1.5 years now. I started in data management, looking through all of the monthly reports for the 6 countries that we currently work in, and have since moved on to the Behavior Change Communications for Education study. And what we're trying to do right now is,
Wait, have you visited any of the countries? Have you been to Ethiopia?
Ethiopia, yeah. I was there for 2 months. Actually, when I was there doing a workshop with teachers and health extension workers on education materials, Oumer was running a meeting on neglected tropical diseases across town.
So you're old friends already. All right.
So one of the things that the Carter Center does is focus on facial cleanliness and environmental improvement, to the last 2 pillars of the SAFE strategy. And
Can you tell them what the other...
Yeah, so the SAFE strategy is surgery, antibiotics, facial cleanliness, and environmental improvement, where environmental improvement is building latrines and using latrines. And so we've been really successful.
By the way, the Carter Center has been responsible, I think in Ethiopia, about 2,800,000 latrines. So in Ethiopia, I'm more famous as the #1 latrine builder than I am for bringing peace to the Mideast. Go ahead.
Well, and we have so many latrines, but one of the problems, not just for the Carter Center, but for the WASH, which is Water, Sanitation, and Hygiene sector in public health, is that we have great coverage of latrines in some places, but the utilization is just not there. And so this study was trying to get at what do we do to try and increase latrine usage, and also looking at facial cleanliness and other WASH behaviors. So we went to all 10 zones of the Amhara region and did focus group discussions with teachers, community leaders, students, Women's Health Development Army workers, and then also interviews with the health extension workers, and also went to households in every single zone to get at what they had for a latrine, if they had a wash station out there, and then did an interview with them as well. And one of the things that we found was that in the primary schools, the teachers were wanting more trachoma and wash information in their curriculum. They said it was absent for the most part, and there was maybe a lesson in grade 5 and grade 8, but for especially the younger children, there just wasn't anything in the education materials. So right now we're working on getting this information into education materials and looking at how we can address some of the things like The notion that if you're too tired or you're just a farmer, you don't have to wash your face. Or if you don't have soap, what are the other local alternatives that you can try and encourage to use? And what if you're afraid of the pit in the latrine? What if it's full? What do you do then? So that's what we're working on right now. I'll be back in about a month to present some of these findings and continue working on it. But yeah, it's going well.
In Africa, quite often, the poorest people don't have any concept of washing your face. So if you go to a Maasai village or a Dinka village from a distance, you see the little children and you think they have eyeglasses on. When you get closer, you find it's a ring of flies around their eye, just sucking the moisture out of their eye. And those flies carry the trachoma disease from one person's eyes to another. And what happens is that in the extreme cases of trachoma, the upper eyelid turns inward, so that the eyelashes, every time you blink your eye, the eyelashes slash the cornea, and that causes blindness. It's the #1 cause of preventable blindness on earth. And Ethiopia has the worst case, highest percentage of trachoma of any country there is. So to wash your face is a very important element of a child not developing trachoma or total blindness as they get old. The surgery part, we've trained a lot of nurses, you might say, or physician assistants to perform the surgery, which is just a simple eye operation on the upper eyelids so that the eyelashes won't be inward and slashing the cornea of the eyes and causing blindness. And we build a latrine so that we can reduce the number of house flies that carry the disease back and forth. And quite often the people have never had a latrine. In Ethiopia particularly, and in some other countries too, it's completely taboo for a woman to relieve herself in the daytime, either to urinate or certainly not to defecate. And so they do it inside the house or right where the family compound is, and the flies breed where the people are living, and it causes a cloud of house flies that carry the disease much more regularly. So we build latrines and urge the people to use the latrines during the daytime. As a matter of fact, this caught on much more than we thought. The first year we thought we might have 10,000 latrines, and by the end of the year we had over 100,000 latrines built because the women adopted it as a women's lib commitment. They made their husband build them a latrine so they could go to the bathroom in the daytime. So it's been a very successful program. In other countries as well, all 6 countries we're building latrines. So the surgery and the antibiotic treatment that's given to us by Pfizer company and washing your face and building latrines, those are the things that prevent trachoma. And it's a horrible disease that we try to address in this wonderful way that they've described. Okay, and we'll let Daniel, why don't you go next? Daniel next, and then we'll save you for dessert.
Hi, I'm Daniel Thompson. I'm a second-year PhD student in the anthropology program. I study cultural anthropology. I had an amazing opportunity to work with the Carter Center during South Sudan's transition to independence. I started as a graduate assistant in 2011, and then subsequently worked as an independent contractor doing cartography, conflict analysis, conflict mapping over the next 2 years as amidst a host of border conflicts as well as conflicts within Darfur, the 3 areas in North Sudan, and then kind of militia conflicts in South Sudan as well. In 2011, I did a couple of field visits to South Sudan and ended up going and assessing conflicts in communities along federal borders in South Sudan. So we were specifically looking at a border that is a big flashpoint between the 2 largest ethnic groups in South Sudan, the Dinka and the Nuer, and looking at kind of historical patterns of conflict along these internal borders and how they relate to kind of broader national patterns of conflict, attempts to state build, and then I guess how the states are divided along national, along ethnic borders, along kind of religious borders, perhaps in the sense of North Sudan and South Sudan. This really contributed a lot to my thinking in terms of both my ability to use GIS, cartographic systems and spatial analysis, as well as kind of thinking about how space is organized and how politics are organized within space, how countries are separated from each other, how federal states within countries are separated from each other. This has led me to my current research, which is specifically on the economics of borderlands in Ethiopia. So I work in a different region of Ethiopia than either Oumer or Nicole or Amelia. I work in Somali region, which is the easternmost part of Ethiopia, specifically in a town named Jigjiga is where I'm carrying out my dissertation research. It's located between a national border with Somaliland, which is not an ethnic border. It's just ethnic Somalis, linguistic Somalis on both sides of the national border. On the west side of Jigjiga is a federal border, an internal border, that is an ethnic and linguistic border that's between ethnic Somalis and ethnic Oromo people. And both these borders are actually, I was surprised when I got to Ethiopia that both these borders are enforced, but also in different ways. Even you think, in the United States, you can just kind of get in your car and travel from Georgia to Florida or South Carolina, or wherever you want to go. Nobody's going to stop you. There you are, you get off the bus, you're searched. If you have certain trade goods or things that could be valuable, they can be confiscated. They're taxed along federal borders. And so these different processes of crossing the internal border within Ethiopia and the national border are kind of intersecting in this town of Jigjiga. So my project really, and my thinking both in terms of my work, my previous work for the Carter Center, my current project is really about these border interactions and how they also travel across space, because these interactions don't actually just take place at the border. Even you look at the events this weekend, for the past year, the Islamic State has been really talking about the Sykes-Picot Agreement of 1916 and has used this border, this historic border, to mobilize people of all different nationalities in their kind of effective space. And this is used to carry out, to get people to carry out attacks, or this kind of discourse supports people carrying out attacks in a city that has some historical relation to the creation of this border. Because the Sykes-Picot was a negotiation between France and England, as you know, or Great Britain. So I think that to think through how these kind of different borders, to look at it in the way of what is the impact of an internal border that's also linguistic and kind of ethno-national versus kind of an external nation-state border that's not that. And there are all kinds of different forms of trade that transit, both legal and illegal, across both borders that are supported by family networks, kinship networks, as well as kind of patron-client relations and just, kind of independent trade that cross these borders. I'm really fascinated about this, and specifically from the standpoint of how borders mobilize people to act in certain ways upon certain identities, and to treat people differently, perhaps because they're from one side of a line versus another.
What Daniel is doing is extremely important because it brings kind of a new realization, certainly to me, that quite often a border inside a country might be much more important to the people who live there than the international border between two countries. Not only between like states in the United States, but also like a county or just a section of a town, where people who live on one part of town in a city might have a complete discrimination against dealing with, trading with, or giving social or economic status to people who live in a different place in town that might be in a different tribe. And so I think this is very fascinating work, and I hope you will continue with it and let us know what you find out at the end.
Yeah, thank you.
Are you going to go back to Somaliland and Ethiopia again, do you think?
Yeah, so I was previously actually working, kind of this idea came to me when I was living in Johannesburg and looking at ethnic divisions within the town between Somalis and Ethiopians in Johannesburg. I was in Jigjiga this summer, and I'll go back again over the next 2 years or 3 years.
One of the most tragic examples in which the Carter Center has been involved is our long-time struggle to find independence for South Sudan. And when we finally got independence for South Sudan, we found that the internecine battles and animosities in South Sudan were worse than it had been between North and South Sudan when they had a 16-year war. So these are the kind of things that Daniel is now exploring in a very, I think, in a very revelatory way. Thank you for that. And now, finally, let me see, Abidemi? Is that the way you pronounce it?
Yes.
Abidemi, okay, very good.
Thank you very much, President Carter. I would say that I'm very glad to be on this panel. I'm a product of one of your awards, that's the Hubert Humphrey Fellow Award. And since I finished that, I've had a lot of motivation to do something. Carter Center isn't new to me. Back in Nigeria, Carter Center has a strong presence, especially in the rural communities, especially in the south part of Nigeria and the northeastern part of Nigeria, where there's a lot of trachoma, guinea worm. And I know while I worked with the
no
ministry.
more guinea worm, right?
But that's things, you know.
No more guinea worm in Nigeria.
So that's one of the great achievements.
Yeah.
I was so excited. I was here when Nigeria was presented with the certificate, and so I was so happy. And that also has to do with the way Carter Center works with people in communities, that it's very different from the way other NGOs work, because you work with the government and you also work with community leaders to find solutions that are community-based and appropriate, and that can be applicable to that community. And one of the things that topped my joy was when you launched a book on sexual violence.
Yes.
And that for me was a very good step, and something that I feel like, since you have gotten on board with this sexual violence thing, I'm beginning to see a light at the end of the tunnel. I've worked in the Ministry of Health, and I've worked as a clinician, and I observed that the issues about sexual violence are not just issues that can be addressed by making policies or, you know, having laws, but they also go more deeply into the norms of the people and the culture and the ways they make meaning out of every kind of abuse that they
Can I interrupt you?
face.
By the way, when she mentioned sexual violence, she really is talking about rape, because she has really, instead of getting into the nuances of how do you define sexual violence, she decided to concentrate on rape. And so this is what she's addressing. Is that correct?
Yes.
Go ahead.
So I'm dealing specifically in my research on rape, and my research is going to focus on two comparative African communities. One is going to be in Nigeria, and the other I hopefully should be in Atlanta here among refugee communities. The reason
How
why...
many of you would have chosen those as two African communities? Atlanta and a place in Nigeria.
Yeah.
It's Clarkston, Georgia, right?
Yes.
Right outside of Atlanta.
Yeah, and basically because I found that a lot of times, even when we transmigrate and we relocate, we don't separate from our culture, and we usually adhere to a lot of the cultural nuances and the meanings and the ways that we perceive and we deal with issues. And what I'm interested in seeing is the Nigerian community is a non-conflict community. So I'm interested in seeing how they make meanings of rape. And because I believe that this is very important for us to be able to like have interventions that would address, because when you know why people wouldn't come to the hospital or why people wouldn't report a rape case, it might not be that the hospital isn't closed. It might not be that they're not literate enough to know what they should do. It might be that there's some cultural nuances that they are holding fast to and do not want to break. And also they might also have other avenues where they seek this their own forms of redress rather than going to the police or going to the hospital. So I'm just open to like seeing what are those other avenues that people are looking for redress that are not in, are not being covered by the national policy, which is basically focused on the medical legal system. And looking at the post-conflict refugee, that for me would be an interesting thing to look at, because like seeing how their transnational migration might have changed some of the nuances that they have around rape, and might not have changed. Probably they still holding fast to that, and why that is the case. So I'm really excited about this because I believe that not just having these facilities out, because I've had experiences where I would give an example of a case of a young girl, a 9-year-old girl that was brought to the clinic while I was working in a suburban clinic in Abuja. The mother is literate, she's educated, and she knew where to go. She knew that her daughter needed some kind of treatment. And I think she also knew that the girl was being abused, because what she came to the clinic for was the presenting complaint was discharge.
Was she in Nigeria?
Yeah.
Go ahead.
And she came to the hospital and she said, my daughter has profuse smelly vaginal discharge, and that was the complaint. But when we examined, it was obvious that this girl has been abused. She's been sexually molested. And we did the treatment, and we were supposed to follow up, and because for that age it's a reportable case. But I guess she knew that the next step would be that we would have to like involve the police and get the social worker, but she never came back. And the address that she left was not traceable. And from like interactions that I had with her, I kind of knew that she wasn't seeking for anything beyond the treatment.
Yeah.
And so that's just one of the few examples of some of the experiences that I had while working at the clinic, not to also mention the fact that even when I've had cases of adult women that were graduates, like had university education, and were raped. And they never reported to the hospital. One particular case, actually, it was the spouse that spoke to us about it, and that was 2 days after the rape, and he was so conflicted within him, and he even wanted to put away his wife. And it took a lot of counseling, you know. He got her to get the pre-exposure prophylaxis, STI management, and the post-pregnancy prevention pills. But, you know, that set a lot of questions in me, that why is it that even with the education, even with the knowledge about where to access services, people still do not want to go? Or probably there are other avenues that people are looking to that are not included in the way that we plan or design interventions that we might need to like discover. And so knowing that you're doing a lot on sexual violence you did something, Carter Center did something with the British Embassy a while ago, and that was also very nice. And I'm hoping that the findings from the research would help inform how we design interventions, and even probably changes in the policy in order to structure it in a way that people can find it meaningful and helpful.
So what you're doing primarily is comparing the incidence of rape in a community of Nigerians who've moved to it near Atlanta with what they experienced or the standards they set back home in Nigeria. So it's basically, you think, so far a matter of custom and development of prohibitions against rape within families rather than the national laws. Yes. Is that right?
Yes. And I'm also thinking that the laws in Nigeria are kind of like, we have like 3 tiers of laws. We have, which a lot of times are conflicting. We have the customary, we have the Sharia law, and we also have the national law, and they speak differently. And so that itself is a big challenge for women, because depending on where you find yourself in the northern part of Nigeria, which law do you choose? Because they have different definitions around rape. And so how does that factor out in the fact that if the woman speaks out and she says she's been raped, there's also issues around the stigma that is associated with rape.
Yeah.
And so why would she want to go the whole haul and still not have the justice that she deserves?
Well, you see what a wonderful array of subjects these young people have adopted as their main interest for their dissertation or for whatever other academic purpose they have pursued. It's really important to us to assess what they do and to learn from them as well. And when our interns make reports at the end of their session at the Carter Center, we really pay attention to what their recommendations are. And we try to incorporate their innovative ideas, which quite often are much more stimulating and exciting than the ones we get from old people like the one sitting on the front row here, or from me. And so it's very helpful to us. I think now if the audience has any question, yeah, you can ask. You want me to answer a question from them first? Okay, I was going to make them answer a question from the audience, but that'd be fine. Whatever. If you all have any questions for me, I'd be glad to try to answer them.
I have. My question for you is, from your experience, looking at the peace situation on this world at this time, and the new tragic developments these days, how differently we all should do things better in a different way from your experience?
Well, I think that we now have a situation where, for the first time, there's been a small cadre of acknowledged and proud terrorists who have put the whole Western world into a state of consternation and not knowing what to do. The problem with the ISIS is basically that no one wants to fight them except some of the Kurds, as you know, in the northern part of I'd say Syria, and maybe some countries nearby. And so the United States doesn't want to send troops to fight, and France doesn't want to send troops to fight, and Saudi Arabia doesn't want to send troops to fight, and the ISIS basically prevailed. And so this is a very serious problem that I think requires the coming together of all the groups. The 27 or 8 countries in Europe has agreed this weekend to back up France and all of them to make their forces similar. But I still don't know of any that has committed to send troops into battle ISIS. And this is a group of fanatics, as you know, who are willing to sacrifice their lives. In fact, they are very proud to blow themselves up, very similar to what the Japanese did during the kamikaze years when I was in the U.S. Navy. I was in a safe place, but a lot of my friends were killed when kamikaze planes deliberately crashed and killed the pilots. So it's the same kind of thing. So I think we are in the formative stage yet in international agreements on how to address the ISIS issue in a way to stamp them out. We talk about eliminating ISIS and that sort of thing, but nobody's willing to do it yet. But I believe that eventually the Western world will come together and hopefully get the Arab countries also to address the ISIS question. It's a new development for me. I'm quite an old person, and I've seen a lot of things happen, but this is the first time, except for the kamikazes, that I remember that a group of people would deliberately sacrifice their lives for a cause, thinking that they were going to go to some kind of glory after their death. David?
I actually have a question that's kind of perhaps stemming a little bit off of that. You know, I think a lot of us were watching yesterday as states in the U.S. made decisions regarding accepting Syrian refugees.
Yes.
And I was wondering, I'm struck by a tension particularly highlighted by this situation between kind of promoting universal human rights and then where do we promote them, to say that people have, you know, the right to health and to kind of self-determination and livelihoods and things like that. What do you see as kind of the balance or the interplay between being a leader in a national space, but also being a leader in human rights? And I think in context of a world where a lot of times we say you can have human rights as long as you stay in the space where you belong. right? And then perhaps the realistic possibility of having human rights in particular spaces is not as realistic as if people are allowed to move from one place to another.
Well, if any country on earth should be dedicated to accepting people who come here as refugees or as immigrants, it should be the United States. This has been the foundation of our whole country. I mean, all of us in this room, just about, I don't see any American Indians. Their family have come here as refugees, sometimes from a bad political situation, sometimes from a bad military situation, sometimes from just looking for better economic status for their children and for their grandchildren. So my hope is that the United States will not deviate from our commitment to receive people, even from Syria, if they're carefully screened and if they are not connected with ISIS in any detectable way. I had this same question to face when I was president. It was at the end of the Vietnam War, when we had people from Vietnam and Cambodia who were under threat of being condemned and killed by the Viet Cong because they had fought against the Viet Cong while we were their allies. And so we began to accept over 12,000 refugees from Cambodia and Vietnam per month. And now we're talking about 10,000 over a long period of time as a tentative issue. So I believe that our country, in every way that it can, should balance the scale or the decision-making process toward accepting people who come here for refuge from oppression or from horror or from the loss of life. And if we have to tighten up on the screening process, that's something that I think our country is capable of doing. The Carter Center overall umbrella under which we operate in every aspect of life is human rights. We think people have a right to have a home in which to live, that they have a right to have education, they have a right to have medical care, they have a right to have a job, have a right to have freedom to choose their own leaders. I mean, it's all human rights. You have a question?
Yes, thank you. So as you mentioned, the Carter Center has made the conscious choice to engage with governments and groups that may not be recognized or approached by the U.S. government or other international bodies. And so I'm curious on your thoughts of how an organization like the Carter Center that works with both government and civil society can work with those governments who may not have strong human rights track records without appearing co-opted or complicit.
Well, we get criticized sometimes because we deal with these so-called nefarious people. You know, the Carter Center has worked ever since I left the White House and while I was in the White House to bring peace to Israel and its neighbors. And so we know that both Hamas and Fatah are involved in making decisions for the Palestinians. So I go and meet with the leaders of Hamas and the leaders of Fatah. We also have had very serious problems that I mentioned earlier in Sudan. And as you know, the president of Sudan has been condemned by the International Criminal Court. But we still, when I go to Khartoum, I meet with the president of Sudan. We went and monitored the election early on in Nepal. In fact, I went to Nepal 3 different trips in 2007 and early 2008 to help them bring about democracy in Nepal. But the ones who won the election were the Maoists. And the United States condemned the Maoists as terrorists, and our ambassador wouldn't have anything to do with the people who won the election in Nepal. The Carter Center was there. And I've been to North Korea 3 times to meet with the leaders there. But although we know their human rights abuses and we condemn them, but we go anyway. And a lot of people warned us, the Carter Center, just in the last 2 weeks, not to go to Myanmar because the military dictators were believed to be so committed to holding power that they wouldn't have an honest and free election. The election was very admirable in many ways. So we try to do, and I've been to Cuba several times. I meet with the Castro brothers when the United States wouldn't, before the United States would. So I think that the Carter Center, as a non-governmental organization, should have the freedom and take the initiative to go and reach out to people who cause a problem or who are the foundation for a continuing problem and see if we can get them to change their way of life. First time I went to Ethiopia, I had just been climbing Mount Kilimanjaro. As a matter of fact, I came down, and Mengistu, who was a dictator of Ethiopia in those days, was preventing the Universal Red Cross, the International Red Cross, and the United Nations High Commission on Human Rights from refugees from going into the two very large refugee camps. And the dictator, Mr. Mengistu, whom I despised when I was president, was not letting them deliver food and medicine and water to the so I agreed to go to Khartoum and meet with Mengistu. And within 30 minutes, I had worked out a complete deal because he was so happy that a foreign leader like me would come and meet with him. He just said, "I'll do anything you want me to," so he did. So that doesn't always happen, by the way. So you see, sometimes it's the incisive and I'd say non-restrained ability of me to treat both sides of an issue with respect is good for improving the peaceful process. But we get a lot of criticism because of it. And we did the same thing when I was president with basic human rights, because we treated everybody the same, even the poor people that were condemned back in those days as communists. Anybody that was against a South American dictator when I was president was a communist. But I worked with them, and eventually every country in South America became a democracy because of that human rights policy. So I think it's the right thing to do. I'm a highly biased assessor. Yeah. Anybody else have a question?
Obviously, the Carter Center has been very active in observing elections and
Yes.
aiding countries and promoting the quality of their own elections. Besides elections, what?
No, we don't promote the quality about my own election.
Right. Yeah. Right.
Okay, go ahead.
So besides focusing on elections, what other aspects or characteristics of a country do you think are also important in democratization? I know the electoral realm kind of gets most of the attention, but what other factors do you think are key?
Well, sometimes a country doesn't have an admirable democratic system like Ethiopia doesn't. And one of my best friends in the world was Meles Zenawi, who was the first leader of Ethiopia when it was supposed to be a democracy. But when we went there and offered the health services to Ethiopia, he responded immediately. He was a very firm and capable leader. And he put together two agencies in the government that made it possible for us to do the things that Oumer has already described. He required the Minister of Health and the Minister of Education to cooperate with each other and not squabble with each other. And so that was a key, I think, to all the success that Oumer has described in his paper. And so I think that sometimes a person can be insistent on staying in office, which we deplore after the Constitution permits, but they might be quite benevolent to their people in trying to provide better health care and so forth. Do you understand what I mean? So you can have a fairly good government even though they stay in office more than the Constitution permits. So they violate the principle of democracy, but they might have fairly open government for access to information, for instance. So you can have some elements of a democratic society blatantly or apparently available to the people, but not have pure democracy as some would define it.
So okay. I think we're at the hour of having to wrap this up.
Sorry.
And no, it was marvelous, and I think your last comments really put a very fine point on how complicated it is.
It is.
There are complexities to deal with, and we are hopeful with this young group of scholars and activists that we are in good hands for the future and all the work you've done through the Carter Center.
Well, I hope you'll encourage them to continue to do very innovative
Yes.
things, which they have demonstrated today, things that other people may not have thought about it.
Exactly,
It's really exciting to me,
exactly.
as you can tell.
We like to say we have field-defining faculty and field-changing graduate students. So they are indeed that. So we're deeply grateful to you, President Carter, Professor Carter,
Thank you.
on this day, and we will look forward to our next visit.
I think
with
the
you.
young people deserve a round of applause. Thank you very much, man. Good luck to you. Thank you, sweetheart. Thank you very much, David. Thank you very much. Thank you. Good job. And I appreciate it. Thank you all, everybody.